Welcome. And my name is Dr. Lisa Fish, and I am a member of the Endocrine Society's Advocacy and Public Policy Outreach Core Committee. I am a practicing clinician and a teacher at Hennepin County Medical Center in Minneapolis and an assistant professor of medicine at the University of Minnesota Medical School. I hope you've been enjoying your experience here. As you know, the topic of today's news conference is obesity. And obesity, as we're all aware, is a worldwide epidemic. In the developed world, the U.S. has the unenviable position of being the leader with the highest rates of obesity. Now we have 33% of the adults in our country have BMIs over 30. It accounts for greater than 20% of the medical expenditures in this country, and the causes are increased caloric intake, sedentary lifestyle, and genetic predisposition, and less commonly, medication side effects, specific genetic deficits or defects, and endocrine disorders. Medical science, again, as we're aware, has not been very successful in treatment. There are nutritional guidelines and lifestyle recommendations which have not been very successful, although the rate of obesity in children recently has stopped climbing, which is, shows some success. There's a small number of modestly useful medications. They're often not covered by insurance. And then we have gastric surgeries, which are successful, expensive, and have short and long-term complications, but do reduce mortality. In endocrinology, we diagnose and treat obesity and the resulting diabetes, which is a big portion of what we do. And we also have many physicians and scientists in our specialty that do research into the mechanisms for obesity and work to develop new treatments. Today we're very lucky to have with us three researchers who are going to present their research. We have Dr. Elizabeth Thomas, who is a fellow and instructor at the University of Colorado School of Medicine's Anschutz Medical Campus. Dr. Felicia Nowak, who is Associate Professor of Molecular Endocrinology in the Department of Biomedical Sciences at Ohio University. And Ms. Soo-Yun Lee, a PhD candidate in the Translational Medicine Group at the John Curtin School of Medical Research at Australian National University. Over the next 25 minutes, each speaker will present their research. Following all after each presentation, we're going to open the microphone for questions for a few minutes. The news conference is being broadcast live via the web, and there are journalists with us online. Because we are broadcasting live, it's important that all remarks be made into a microphone to enable those who are joining us virtually to hear what's being said. The journalists who are attending online will be able to type their questions during the question and answer period. So I would like to invite our first presenter, Dr. Thomas, to the podium.
Thank you. Okay, so today I'm going to be talking about the effects of skipping breakfast on the metabolic and behavioral responses to food in obese women. So diet patterns have been implicated in obesity prevalence. Specifically, epidemiological studies have shown breakfast skipping to be associated with higher BMI, and this has been shown in children, adolescents, and adults. Breakfast skippers have poor overall diet quality, with higher intakes of saturated fat and cholesterol, and lower intakes of fiber, vitamins, and minerals. In addition, longitudinal studies have shown breakfast skipping is associated with weight gain and increased risk for cardiometabolic risk factors, including type 2 diabetes. So studies have shown an association between breakfast skipping and increased BMI. However, a causal relationship has yet to be established. When we think about possible mechanisms, we have to think about energy balance. On one side of the energy balance equation is energy intake. And studies have found breakfast skipping to be associated with increased, decreased, or no difference in energy intake. These studies have mostly been epidemiological studies and have relied on self-report in terms of energy intake, which is known to be fairly unreliable and may account for the differences in findings. On the other side of the energy balance equation is energy expenditure, and this has generally not been assessed in most studies, or they've found no difference, again using self-report methods. So there have been some small short-term studies looking into the metabolic and appetitive responses to breakfast skipping. These have been mostly done in lean individuals and habitual breakfast eaters. These studies have shown breakfast skipping to be associated with impairment of insulin sensitivity. Some have shown increased energy intake, others have shown no change. Most of these studies have showed increased hunger and decreased satiety with breakfast skipping. And one study in particular showed a deterioration of lipid profiles after a 2-week period of skipping breakfast. So this study is a randomized crossover trial of eating versus omitting breakfast in overweight and obese women who are habitual breakfast eaters or breakfast skippers. Our study population included women of all ethnic groups between the ages of 25 and 40, BMI range of 27 to 35, and we included habitual breakfast eaters and breakfast skippers. We excluded women with uncontrolled thyroid disorders, diabetes, eating disorders, pregnancy, or women without menses for other reasons, and also active dieting or intensive training regimen, night eating syndrome, and subjects unwilling to eat the foods comprising the test breakfast. 2 study days were performed 1 month apart during the follicular phase of the menstrual cycle. Subjects were asked not to perform any purposeful exercise prior to each study day. They were provided with a standard dinner the night before each test day. The dinner provided 35% of their daily energy intake as calculated using the resting metabolic rate with an activity factor. And this contained a standard macronutrient content. All subjects presented to our CTRC at 7 a.m. had their height and weight measured and had fasting labs for glucose, insulin, free fatty acids, and triglycerides. A quick overview of the study procedures. Just before the baseline or breakfast, subjects had their fasting labs drawn, and 0 hours was counted at the time that they started eating their breakfast or drinking the water. The lunch was provided at 4 hours, and labs were drawn every 30 minutes after the lunch, and there was a dinner provided at 9 hours. On the breakfast day, subjects received a breakfast, which provided 25% of their total daily energy intake and was comprised of the foods shown here. On the no breakfast day, they received water alone. On both days, they received a standard lunch, which provided 35% of their daily energy intake, again with a standard macronutrient content, and was composed of foods similar to those shown here. They also were provided with an ad libitum dinner at the 9-hour time point. So we studied a total of 10 subjects, although we only have laboratory data available for 9 subjects here. Their average age was 29.4, their BMI was 31.4, predominantly Caucasian and non-Hispanic, and their baseline breakfast eating habits were mostly breakfast eaters, although we hope to continue the study and enroll equal numbers of breakfast eaters and breakfast skippers. So looking at the insulin response to the lunch meal, you can see that the insulin levels did not differ at baseline. However, there was a higher peak insulin level, and the insulin remained higher out until 150 minutes in the no breakfast condition as compared to the breakfast condition. Also, when we looked at the area under the curve, it was higher in the no breakfast condition. Similarly, glucose peaked at a higher level in the no breakfast condition and remained higher out until 180 minutes, and the area under the curve for glucose was also higher in the no breakfast condition. Free fatty acids were different at baseline. As you can see, they were higher in the no breakfast condition, and this is expected because subjects have not received any calories up to this point during the day and are therefore undergoing higher rates of lipolysis and would have higher levels of free fatty acids. And the free fatty acids were appropriately suppressed following the lunch meal, but the area under the curve remains higher in the no breakfast condition. Triglycerides also were different at the pre-lunch time point, and again this is something to be expected because in the breakfast condition these subjects have received calories in the form of a meal which did contain triglycerides, and we would expect to see their triglycerides higher. So the area under the curve was lower in the no breakfast condition, but if we looked at the incremental area under the curve, there was no difference, suggesting that the difference was driven by the pre-lunch values. So a quick summary of these lab results. In the no breakfast condition, the area under the curve for insulin, glucose, and free fatty acids were higher, whereas triglycerides were lower. Our conclusions are that in obese women, skipping breakfast results in acute relative insulin resistance and elevated levels of free fatty acids. And it's possible that insulin resistance over time may predispose to further metabolic derangements and possibly progression to type 2 diabetes. These are my acknowledgments and list of my grants and support.
Thank you, Dr. Thomas. We can open this up for questions. I have a question in that in diabetes we talk about a first meal effect, and this is in people without diabetes, but we see something similar, I believe.
Yes.
Can you comment on that?
Yeah, the second meal effect or the Staub-Traga effect is well known in the literature, and it has been studied mostly in diabetes. But again, some of the literature has shown it to be present in normal individuals as well. However, most of the studies done in that line of research look at a shorter duration between the first meal and the second meal, as opposed to looking at the breakfast and lunch phenomenon. It's possible that it could be similar mechanisms that are leading to improved insulin sensitivity at the second meal, which is basically what the effect is. So we're not really sure what the mechanism is here, but some of the mechanisms proposed in the second meal effect are possibly related to the suppression of free fatty acids after eating the first meal, and which leads to glycogen storage, which may decrease the glucose and therefore the insulin response. Yes.
Hi, Todd Neal with MedPage Today. Are there any studies showing that these short-term effects would have longer-term consequences?
Well, there aren't any studies in terms of randomized controlled trials that would look at that, but there are longitudinal studies and prospective studies looking at breakfast skipping, which have shown that that breakfast skipping over time is likely to lead to weight gain, and also cardiometabolic risk factors and increased risk for diabetes. So they weren't randomized controlled trials, but there are prospective studies that have followed people over time and shown that to be true.
Hi, Samantha Costa from Endocrine Today. I was wondering if the other eating habits were factored into this study, such as snacking or other meals they may have had when they weren't coming in?
Well, they were, when they came in for the study, they were in a controlled, observed unit for the full day that they were undergoing the study conditions. Prior to that, we did have them record diet diaries, and so we will be able to analyze that data. We haven't yet looked at the data, but we didn't control their diet prior to the study day, other than the dinner that we gave the night before on both occasions, to make sure that the dinner the night before was the same on both days.
And then real quick, are you planning to extend the study and have a larger study?
Yeah, we plan to study 20 subjects altogether.
Hi, Sherry Boschert with Clinical Endocrinology News. These women were obese. Can you comment on whether skipping breakfast would affect insulin in non-obese women? Have there been studies of that?
So there was a study that was done in healthy, lean women, and that was the same study that showed a deterioration of lipid profiles after 2 weeks of breakfast skipping. And in that study, they also did show a decrease in insulin sensitivity. I'm not exactly sure about the exact numbers of Americans that skip breakfast. I know that in the literature, the percentage of people skipping breakfast ranges from about 10 to 20% of individuals. So it's not the majority of people, but still accounts for a lot of people. As far as recommendations to suggest that people not do that, I'm not really sure about that. I think there's a big effort, especially in children, to promote breakfast eating for a lot of other reasons having to do with, their cognitive function in school and that type of thing. So there's other research that's been done in pediatrics, and I think that maybe starting with kids and developing, good healthy eating habits at a young age is probably a good strategy.
And is there data that breakfast skipping is higher in obese people?
Yes, there is definitely very good data that the frequency of breakfast skipping is higher in obese people.
We have a question from Jay Cole of the AP. How much did nutritional values of the breakfast food impact the results?
Nutritional values of the
breakfast that was provided.
I mean, the breakfast that was provided was the same for all of the subjects. It was just the amount that differed depending on their estimated energy requirements. So I don't think that probably the nutritional value affected the results very much.
Although you did feed them a mixed meal.
We did feed them
Right.
a mixed meal.
And many American breakfasts are just high carbohydrate, low protein, not mixed meals.
That's correct. And there have been a lot of studies that have looked at varying the macronutrient composition of breakfast meals and looking at, measures of hunger and satiety at lunchtime and that kind of thing. So we chose the macronutrient content of the breakfast meal just to be standard, and then we chose the actual items based on a survey of obese individuals in our registry, in our nutrition core, and those were popular food items, so that was how we chose the meal.
We set. Great. Thank you, Dr. Thomas.
Thanks.
I'd like to invite Dr. Nowak to the podium. Good job. Thank you.
I need to somehow get out of her presentation into mine, or I just keep going, maybe.
Yeah.
Just keep going.
There you go.
Good morning. My name is Felicia Nowak. I'm at Ohio University in the Department of Biomedical Sciences and also a member of the Diabetes Institute there. I want to thank the organizers of the Endocrine Society meeting for inviting me to participate in this event today and to hopefully get the word out about our research and the research of the other people here. So I'm going to be talking about the effects of paternal high-fat diet on body composition and physical activity in offspring. Our studies are done in mice, so it's a little bit different from working with humans. We get to tell them a little bit more about what they need to do, and we don't have to necessarily adjust our study to accommodate the mice, although we certainly try. So as Dr. Fish already spoke about, there's been a trend toward increasing obesity, and we all realize that this is going to have and is already having medical, social, economic, and psychological effects on the individuals and their families and also society as a whole in the nation. And so it's important for both health reasons and also just for the health of the nation and to look for ways to turn around this high incidence of obesity and the associated diseases that develop as a result of having obesity, which, as we know, include diabetes and cardiovascular disease and a number of other chronic diseases. So we hear an awful lot about lifestyle. Well, if everyone would just exercise more and eat less and eat healthy, we'd all be slim and healthy. That's probably not the whole story, though. Certainly, it is a big part of the story, and parents certainly teach their children by example, so there's no question about that. But there also is good evidence that the metabolic profile of people depends also on their biological inheritance. And we know that paternal obesity is a predictor of childhood and adult excess weight. We also know that if both genetic parents are obese, that more than doubles the risk of obesity in the offspring. So there is a contribution from both the maternal and paternal side. There's been a fair amount of studies that have been done to look at the maternal contribution to the metabolic profile, obesity, diabetes in offspring, and it's been shown that maternal overnutrition and obesity, and also the perinatal hyperinsulinemia that can result, do affect the metabolic profile of the offspring through both metabolic imprinting and the early overnutrition. It's also been shown that there are epigenetic genetic modifications that are transmitted from the mother to her offspring. And these modifications, in many cases, affect key genes in metabolism. So we set out to look at the other side of the story, and we wanted to, our overall hypothesis is that environmentally induced inherited epigenetic changes due to diet can be transmitted from the father to the offspring, and that some of these changes will impact energy metabolism and utilization in these offspring. There have been studies done to show that high-fat diet-induced obesity in fathers does impact fertility. There's been a lot of work on that, but not very much on obesity and the overall metabolic status of the offspring. So let me just take a minute to talk about epigenetics. We're hearing more and more about this term, and a lot of people often ask me, what is epigenetics? Can you tell me exactly what that is? So that's the study of inherited alterations in gene expression that are not caused by changes in the DNA sequence. So when we think of inheritance, we often think of mutations, changes in the DNA that get passed down from generation to generation. These are changes in how the genes are expressed, and they are modifiable. So epigenetic mechanisms can be modified by a variety of environmental influences, and diet is just one of them. And the resulting changes in gene expression can be temporary, or they can be permanent within the individual. There's a lot of work going on to try to understand the mechanisms that are behind these changes, and we still have a lot to learn about this. We do know something, though, about some of the biochemistry of these modifications, these inherited modifications. Include things such as methylation patterns, modification of histone proteins that bind to the DNA, and also regulatory DNA binding proteins that affect the expression of genes. And these, especially the methylation and the histone binding, they actually regulate how the structure of the DNA is, and so how easy or difficult it is to actually transcribe a particular gene. And that's important because if you have more or less expression of particular genes, that can have an impact. And it is known in general that many genes that are critical to energy balance are regulated by epigenetic mechanisms. But the question of whether parental diet can affect that is what we're working on specifically. So our goals or specific aims in this research were to develop a mouse model of transgenerational transmission of metabolic disease or metabolic differences due to paternal preconception high-fat diet-induced obesity. So we put animals starting at 4 weeks of age on either a high-fat or low-fat diet. The females were all on the low-fat diet. So the difference was that the males were on either a high-fat diet or low-fat diet. The high-fat diet was 45% fat. The low-fat diet is 10% fat. And the diets are matched in as much as possible in all other components. So our first goal was to identify the phenotypic changes in the offspring of the males. Then our next step will be to determine which specific genes are affected, and finally to look at the mechanisms that affect these genes. So what we have found is that the paternal diet affects the body weight of the offspring, and it's important to note that all the offspring were just on standard laboratory chow. They are not on a high-fat diet. And we saw that in the males, the male offspring weighed more when their fathers were on a high-fat diet at 6 weeks and 6 months and 12 months of age. And remember, they're on a regular diet. There also was an effect on the body composition of the offspring, with the male offspring having a higher % fat at 6 months of age. There are also some gender differences that we observed, and although I'm not going to go into detail about those, they are included on the slides. We also found that there was a difference in the fat distribution within the animals. So as you may know, fat is deposited in different places in the body, some internal fat pads and also under the skin, so-called subcutaneous fat. And what we found was that these internal fat pads deposition into those was increased while the deposition into the subcutaneous fat was decreased. And we know from other studies that the localization of the fat within the body has an impact on the effects on metabolism as well. So we also found, I'm just going to skip over that because that's more of that, that the offspring of the parents, of the fathers on the low-fat diet showed a substantial increase in the subcutaneous fat as they aged, whereas the high-fat diet offspring did not. And finally, we found that there was a difference in physical activity of the offspring, and this was a very unexpected finding. We found that the offspring at the very early age of 6 weeks, the male offspring actually, when given a chance to run on a running wheel, they ran more when their fathers had consumed the high-fat diet than did the offspring of those that consumed the low-fat diet. And people have said to me, oh, so it's kind of like they're programmed to try to avoid having the same thing happen to them. So that's a possibility, and of course we'll need to see what the exact mechanism of that difference is. We also found the females ran more than the males in most of the groups. So I've already told you that paternal preconception diet can affect body weight, composition, fat deposition, and voluntary physical activity of the offspring. We think that this is due to epigenetic mechanisms because of the rapid induction of these inherited differences just over one generation, and we hope that our model will enable us to identify the specific genes that are involved and also the mechanisms that are involved, and then individuals at high risk for developing obesity who may have some of these genetic modifications, along with their physicians, may be able to design therapies and strategies for prevention of developing the same metabolic problems in the offspring. And thank you for your attention. Thank you.
Thanks, Dr. Nowak. That is, the epigenetics is fascinating. There's recent data looking at evolution and saying that the 13,000 years since the last ice age is not enough time for us to have evolved the obesity problem that we've got. So the epigenetic explanation is a fascinating one. I was curious with your data, you did have differences in that the female offspring were leaner of these fathers that had fed the high-fat diet. Do you have any comments on that?
So at this point in time, I don't know which genes are involved, and we also, for some of the more controversial findings, we are going to increase the numbers of animals and make sure that we are on solid ground with any of the results that we have. But I think that it's possible that that is the case. And I think that it's been shown for many different epigenetically inherited changes, differences, that there are differences between the male and female offspring. And there are also have been a couple of studies done that show that the offspring may transmit further to the grandchildren, as you would, these epigenetic changes, and that sometimes only the female offspring will transmit them, and sometimes only the male offspring will. So the fact that there are gender differences actually, I think, confirms the idea that it could be epigenetic and it's not genetic.
Mm-hmm. And we'll open up for questions.
Thank you very much, Jeremy, with International Diabetes. I was wondering, when it comes to the fat deposition in the father, do you see the similar kind of fat deposition in the offspring? You mentioned that they have more central adiposity rather than peripheral. Is Is that the case with the father as well?
We are still in the process of doing those analyses. In this situation, we focused on the offspring, and then our idea was that later we could go back and look at the parents and also both the mothers and the fathers to see if there were differences in that. But that's a very good question. Yeah.
Okay, great. Thank you, Dr. Nowak. I'd like to invite Ms. Lee to the podium.
Good morning. Thank you very much for the invitation. So this is part of my PhD project, and I want to talk about the understanding the long-term effect of weight gain induced by short-term exposure of antidepressants. So 12.3 million antidepressant scripts have been prescribed in Australia in 2008, and the population of Australia is about 22.3 million. In clinical studies, there has been significant weight gain of 7% or greater associated with antidepressant use. However, due to large variations in clinical studies, the association between antidepressant and weight gain remains unclear, so that the mechanism behind the antidepressant use and the weight gain is still unknown. So, in animal models, it's a little bit more complex, and animal models have shown that antidepressant use has paradoxical weight loss and reduced in food consumption. However, these studies did not take the factor of diet, where in clinical settings, every individual have different choices of diet, including high-caloric diet. So initially, Mastronardi et al. From our group, and we have developed the animal model that addresses the paradoxical weight loss. So in this model, so this is the rat model, we have treated animals with short-term exposure of antidepressant plus stress, and followed by long-term exposure of high-fat diet. And we have called this model as a stress antidepressant diet-induced obesity. So with our animal model, we have hypothesized that stress antidepressant diet-induced obesity is different to diet-induced obesity. In order to test our hypothesis, we have developed 3 different models. Firstly, diet-induced obesity, where rats were given high-fat diet, solely high-fat diet for 295 days. And secondly, a model that addresses the factor of stress and diet, and we have given 2 weeks exposure of stress followed by long-term high-fat diet. Thirdly, but most importantly, we have developed the antidepressant stress diet obesity model, and here we have given stress for 2 weeks. At the same time, we have given antidepressant followed by high-fat diet. And because these are the genetically outbred rats, some rats are prone to obesity, but some rats are resistant to obesity. So these resistant rats never gain the weight even presence of high-fat diet. So we have decided to focus on the obesity-prone rats based on their body weight. So we have used 2 different antidepressants, which were fluoxetine, and the other one is the imipremine. So we have followed the body weight for 295 days. And it was shown that the animals that were stressed never gained the body weight of diet-induced obesity. So this is the model that was not stressed. There was the model that was just solely given high-fat diet. However, imipremine-treated group gained partial amount of weight. And furthermore, most interestingly, fluoxetine-treated group not only recovered the body weight of the weight loss induced by stress, but they became even significantly heavier than the diet-induced obesity. So this is the body weight on day 295. And so this data was accompanied by food intake ratio. So the food intake ratio for the antidepressant treated group were lower, which means that they gained more weight given the same amount of food, and this was followed by waist circumference and body length. So we have also tested the behavior, and it was just shown that fluoxetine treated group were less anxious. In day 296, we have collected different organs, and it was shown that organ weight of bone weight and spleen weight were heavier in the antidepressant treated group. So in summary, rats received combination factors of short-term exposure of stress, antidepressant, followed by high-fat diet is associated with greater weight gain, the high-fat diet alone. But it is important to note that this does not happen to all the groups of rats, but this is only prominent in the obesity-prone group of animals. And it is not the antidepressant alone that causes weight gain, but it is the context of presence in stress, high-fat diet, and antidepressant. So the message here is that when the rats are already obese or has risk for obesity and given high-caloric diet, they tend to gain more weight. So this was accompanied by increase in body length, circumference, and increase in organ weight and bone and spleen. So in conclusion, that we have concluded that obesity induced by stress, diet, antidepressant gain significantly heavier weight than the obesity-induced diet. However, the pathological mechanism in stress, antidepressant, diet-induced obesity remains unknown, and this is part of my project, which I have recently started, and this should be elucidated in the future. Thank you.
Thank you. It's interesting because in people, we have the older tricyclic antidepressants that cause significant weight gain, the newer SSRIs, which
Yes.
in your rat model cause more weight gain, but in people not. There's quite a bit of data that SSRIs do not cause the same weight gain that the tricyclics did. And then the new antipsychotic drugs, which cause dramatic and severe weight gain. So there is some data suggesting that just treatment of depression alone in people results in weight gain. Do you have any comments on that?
Yes, but our model involves discontinuation of fluoxetine. So we have treated rats with 2 weeks, but during the high-fat diet, it was like a recovery period, and then they were not on the antidepressants. So the mechanism may be slightly different. Yeah.
We'll open it up for questions. Great. Well, thank you, Dr. Lee. Thank you very much. Thank you to all of our speakers and to everyone who attended.